Are you taking medication every day and still feeling exhausted, weak, and unwell? Most seniors over 60 have no idea that the pills they take every single day could be quietly draining their body of the nutrients it desperately needs to function. What if your medication is the reason why? This is not a scare tactic. This is something your doctor should have told you at your very first prescription. But most never do. In the next 12 minutes, I am going to show you exactly which medications are doing this, which nutrients they are stealing, and the simple everyday foods that can protect your body starting today. If you are over 60 and taking any medication at all, do not click away. This could be the most important thing you watch all year. Millions of adults over 60 take at least one prescription medication daily. Many take 3, 4, or even 5 at the same time. This is called polypharmacy, and it is extremely common in older adults. What most people do not realize is that many of these medications interfere with how your body absorbs and uses essential nutrients. Over time, these nutrient depletions can cause fatigue, weakness, memory problems, and even serious health complications. The good news is, food can help fix this. Let's start with one of the most commonly prescribed medications in the world. Statins. Statins are cholesterol-lowering drugs. Brand names include Lipitor, Crestor, and Zocor. Millions of seniors take them every single day. But here is what your prescription label does not tell you. Statins deplete your body of a critically important nutrient called coenzyme Q10, also known as CoQ10. CoQ10 is essential for energy production inside every cell in your body. When your CoQ10 levels drop, you feel it. Fatigue, muscle weakness, brain fog, shortness of breath. Many seniors blame these symptoms on aging. But in many cases, it is their statin medication. CoQ10 is naturally found in foods like beef, sardines, mackerel, spinach, and broccoli. If you are on a statin, adding these foods to your weekly meals can help replenish what your medication is taking away. Some doctors also recommend CoQ10 supplements, but always speak to your doctor before adding anything new. The key takeaway: if you are on a statin and feeling unusually tired or weak, nutrient depletion could be why. Now let's talk about a medication that almost every senior has taken at some point. Metformin. Metformin is one of the most prescribed diabetes medications in the world. It is effective. It is affordable. And it has been used for decades. But long-term use of metformin has been clearly linked to vitamin B12 deficiency. And vitamin B12 deficiency in seniors is serious. It can cause nerve damage, memory loss, depression, and extreme fatigue. Many of these symptoms are mistaken for dementia or normal aging. But they could simply be a sign that metformin is depleting your B12 levels. Vitamin B12 is found in foods like eggs, salmon, tuna, beef, and dairy products. If you are taking metformin, eating these foods regularly is essential. Your doctor should also monitor your B12 levels with a simple blood test at least once a year. If your levels are very low, a B12 supplement or injection may be recommended. Do not ignore this. B12 deficiency caught early is completely reversible. Next, let's talk about blood pressure medications. Two of the most common types are ACE inhibitors and diuretics, also called water pills. Brand names include lisinopril, amlodipine, furosemide, and hydrochlorothiazide. Diuretics in particular are well known for flushing important minerals out of your body. The nutrients most commonly depleted include potassium, magnesium, zinc, and sodium. Low potassium can cause muscle cramps, irregular heartbeat, and weakness. Low magnesium can cause anxiety, insomnia, and muscle spasms. These are not small issues, especially for a senior heart. To protect your potassium levels, eat bananas, sweet potatoes, avocados, and spinach regularly. For magnesium, focus on nuts, seeds, dark chocolate, and whole grains. If you are on a diuretic, your doctor may already monitor your electrolytes. But if they are not, ask them to. A simple blood panel can reveal deficiencies before they become serious problems. Now this next one surprises a lot of people. Antacids and proton pump inhibitors, also called PPIs. These are medications taken for acid reflux, heartburn, and stomach ulcers. Common brands include omeprazole, Nexium, Prilosec, and Pepcid. Millions of seniors take these, sometimes daily for years. Here is the problem. Your stomach acid is not just there to digest food. It is also essential for absorbing key nutrients, especially magnesium, calcium, vitamin B12, and iron. Long-term use of PPIs significantly reduces your ability to absorb all of these. Low calcium leads to weaker bones. Low magnesium affects your heart and muscles. Low iron causes anemia and exhaustion. If you take antacids or PPIs regularly, focus on calcium-rich foods like dairy, kale, almonds, and fortified plant milks. For iron, eat lean red meat, lentils, spinach, and beans. Pair iron-rich foods with vitamin C to improve absorption. A squeeze of lemon or a small glass of orange juice works perfectly. And again, ask your doctor to check your magnesium, calcium, B12, and iron levels annually. Let's also talk about corticosteroids. Medications like prednisone and cortisone. These are prescribed for conditions like arthritis, asthma, lupus, and inflammation. Corticosteroids are powerful and very effective for what they treat. But they come with a significant nutritional cost. Long-term use depletes calcium, vitamin D, potassium, magnesium, and zinc. This combination is particularly dangerous for seniors because it directly accelerates bone loss. Osteoporosis and fracture risk increase significantly in seniors on long-term corticosteroids. If you are on a corticosteroid, prioritizing calcium and vitamin D every single day is not optional. It is essential. Get sunlight when possible. Eat dairy, fortified cereals, and fatty fish like salmon and sardines. Exercise, even gentle walking, helps maintain bone density. And speak to your doctor about a bone density scan if you have been on corticosteroids for more than 3 months. The last medication group I want to cover today is antidepressants, specifically SSRIs. Common brands include Prozac, Zoloft, and Lexapro. SSRIs are increasingly prescribed for seniors dealing with depression, anxiety, and sleep issues. They work by affecting serotonin levels in the brain. But research shows that long-term SSRI use can deplete folate, sodium, and melatonin. Low folate is linked to depression, which creates a difficult cycle. Low sodium in seniors, called hyponatremia, can cause confusion, dizziness, and falls. And disrupted melatonin means poor sleep quality, which affects everything else. To support folate levels, eat dark leafy greens like spinach, kale, and romaine lettuce regularly. Lentils and beans are also excellent sources. For better sleep, reduce screen time at night, keep a consistent bedtime, and eat foods that support natural melatonin like tart cherries, walnuts, and oats. So let's bring this all together. If you are over 60 and taking any medication, you are not powerless. You can protect your body through the food you eat every single day. Statins. Replenish Coke 10 with sardines, beef, and broccoli. Metformin. Protect your B12 with eggs, fish, and dairy. Blood pressure medication. Restore potassium and magnesium with bananas, nuts, and greens. Antacids. Support calcium and iron with dairy, lentils, and leafy vegetables. Corticosteroids. Prioritize calcium and vitamin D daily. Antidepressants. Eat folate-rich greens and sleep-supporting foods. Your medication is managing your condition. Your food is protecting everything else. If you found this video helpful, please subscribe to this channel. We post new videos every week specifically for adults over 60 who want to feel their best through the power of food and lifestyle. And share this video with someone you love who is over 60 and taking medication. It could make a real difference in how they feel. See you in the next video.